mynews.studio.
Trachoma has been around since ancient times, causing blindness for generations. Now, fewer than 100 million people are affected. What finally tipped the scales to get us here?
Quick date check. It's January 14th, 2026. Ellie, to put the scale of this in context, back in 2002, about 1.5 billion people were at risk of trachoma. Today, that number is under 100 million. That's a 94% reduction.
Exactly. And it's more than just a statistic. The impact is real. Just last year in 2025, 6 countries were declared free of trachoma: Burundi, Egypt, Fiji, Mauritania, Papua New Guinea, and Senegal. What got us here? It took decades of steady global effort, improving sanitation, distributing antibiotics, and running focused campaigns.
The SAFE strategy really stands out. That's surgery for advanced cases, antibiotics to clear infection, facial cleanliness, and environmental improvement. Each of those pieces supports the others. But here's a real sticking point: funding. How do we keep this going, especially in communities that are hardest to reach?
Yeah, that's crucial. There's still a $300 million funding gap if we want to hit the 2030 elimination target. Groups like the International Coalition for Trachoma Control coordinate donors, NGOs, and governments. But leadership at the national level is key. If a government doesn't put trachoma on its agenda, outside funding alone won't solve it.
That's where private partners help. Pfizer, for instance, has donated more than 1.1 billion doses of azithromycin through the International Trachoma Initiative. Still, delivery is a challenge. How do you actually get medicine to remote villages or even conflict zones?
It's one of the hardest parts now. Most remaining cases are in rural, low-income areas. Poor sanitation, no reliable clean water, and isolation slow down progress. But there are new tools, like smartphone-based data collection from the Global Trachoma Mapping Project. That means teams can track cases in real time and target interventions where they're needed, instead of spreading resources thin.
And the role of the community can't be overstated. Local people take the lead in distributing antibiotics and teaching about hygiene. It's not just medicine. It's about changing habits and improving water access. Do you think these approaches could work for other diseases too?
That's exactly the idea. The approach used for trachoma, integrated, focused on data, involving multiple partners, can guide how we tackle other neglected tropical diseases. It's tailored, it prioritizes equity, and it uses up-to-date information. It really is a model for fighting diseases linked to poverty.
So this isn't only about reducing blindness, it's proof that coordinated global health efforts using data and local leadership can make a difference. Does this mean other entrenched diseases could actually be eliminated too?
I think it does set a new benchmark. Getting this close to eliminating trachoma shows that big goals are possible. People regain their sight, their independence, and it shows what can happen when the world works together on health.
To recap, fewer than 100 million people now need treatment for trachoma, something that was unthinkable not long ago. Decades of international collaboration, hygiene and antibiotic programs, and new data tools brought us here. Funding and political will are still needed, but the way forward is clearer now.
Exactly. And maybe the biggest takeaway is this: global health victories are real, but they depend on innovation, investment, and working together.
Thanks for listening. This episode was brought to you by mynews.studio. You can try it free today.